Hello, welcome back to Mirror Interpretations Todorova YouTube channel. My name is Joanna and I am an interpreter. Thank you for liking, subscribing, watching and commenting, guys. I am giving you another video for a cardiovascular system. This is video number 4 and we are talking about our heart and our heart rate and what problems we can have related to that. That's, again, I'm repeating, this is medical terminology for interpreters. I am not a doctor, I'm a doctor of science, but I'm not a doctor in the literal meaning. So guys, remember, this is just a general video. I am not a doctor, I'm just giving you a medical terminology for interpreters. Today we're gonna talk about, I will call this video a heart rate. Okay, the heart rate is the speed of which the heart beat, and this is measured beat per minute. So the normal heart rate for adult is between 60 and 100 heartbeats per minute, right? Let's say you're scared, your body automatically will release adrenaline that will automatically raise your raise your heart rate. This automatically will bring more oxygen and energy to the body and give this natural impulse to escape. So our beautiful, delicate body magical system is related with one another, and these magical things are happening inside our bodies to help us stay alive, to help us stay safe. So let's talk a little bit about the pulse. So the heart rate is how many times per minute arteries expand thanks to the pumping action of the heart. So heart rate expand the arteries. So when the heart pump, the blood go to the arteries and expand them and create this ticking on the veins that we can measure right here in the hand, that is called pulse. The pulse and the heart rate, of course, are related. You understand what is that. So the pulse is equal to the heartbeat. When the heartbeat expand, the blood go to the veins and they pump and go down, pump and go down. They are in harmony with one another. So the normal heart rate or the normal pulse is between 60 and 100. I'm gonna start talking a little bit about what is arrhythmia. I will start first with the symptoms. So as you guys know, arrhythmia is a regular heart rate, and a lot of people think that arrhythmia, it only means high blood pressure or tachycardia. I'm gonna give you a little bit more in-depth information about what arrhythmia is, and just to have a slightly more profound idea as an interpreter in order to be the best interpreter possible. Okay, so the first symptoms of arrhythmia, it's okay. One of the first things that we could see is a very hard rate, fast heart rate, irregular heartbeat, and so on. This is the first thing that we know that we have arrhythmia. We can also have a very slow heartbeat, which is called bradycardia, and this is when the heart rate beat less than 60 a minute. Skipping beats, lightheaded or dizziness, chest pain, shortness of breath, we're sweating, or we're swallowing on the hands particularly and in the feet. We're anxious, we have fatigue, and we are fainting. That could be all results of arrhythmia. But let's start talking again what arrhythmia is. So arrhythmia is a problem of the heart rate when we have irregular heartbeats. It could be too slow or too fast. The arrhythmia is happening when the electrical impulses that come from this cordial node on the heart, I'm going to explain on this one, sinus node. As you see, this is our sinus node. If these electrical pulses or impulses are irregular from this part, from this part, from that part, or that part, we have a different type of arrhythmias, okay? So if these electrical impulses or neurotic impulses that make the heart beat are irregular, they can make your heart beat too fast, too slow. Some of them could be harmless and some of them could be a very serious problem. The sinus node, I'm gonna show you here. It's located on our, let me see how you guys gonna see. This is our right atrium, and we have, this is the smallest side of the heart. The smallest chamber is the right one. The bigger one that pump more is the left one. So the sinus node is related here on the right atrium of the heart, right? So this is where the impulses for the pumping in the heart coming from. So this node is the natural pacemaker of the heart. It produces impulses that go from the right atrium down to the right ventricle, and this is how the heart works, and so on and so on. They're all related. So we can have a tachycardia in the atrium, and in the atriums we have left and right atrium. Again, I will show you my painting, left atrium and right atrium, and we can have tachycardia here, tachycardia here. Left ventricle is possible to have a separate tachycardia, and the right ventricle another one. So let's talk about the atrium tachycardia, or atrial fibrillation is called. So the atrial fibrillation, when a rapid heart rate by systolic impulse in the atrium, it's not coordinated, create a weak contraction of the atrium. And this basically, it's not in harmony with the other three parts of the heart. The atrial flutter is similar to the fibrillation, but this irregular heart rate is a little bit more organized. It's like more rhythmic. It's called fibrillation because it's kind of almost okay, but it's not okay, and this could lead to a stroke. Supraventricular tachycardia, it's again the superior part of the left ventricle or the right ventricle. This could mean, this is creation. I will show you here on this painting again. So this is AV node. When there is a regular connection or impulse that is happening here on this node that is located between the atrium and the ventricle, on this area, that's why it's called upper ventricle tachycardia, because it creates a problem on this area. And it's come from this AV node, which is like a small nerve point that sends the impulse to the ventricle, basically. And another thing, another part of symptom of a tachycardia, it's called Wolff-Parkinson-White syndrome. This is a special syndrome that is like supraventricular again tachycardia. It's again on the ventricle area where the connection between the atrium and the ventricle, and we have this node that sends the impulse. It's again happening in this area. We are born, a patient with that are born, right? So this means that there is a extra electric pathway that is present with birth. There could be no symptoms until we get old. So there is these extra signals that come and pass between the atria, from the atrium, but they don't pass to the nodes, to this node that have to pump them away. And they lead to short circuits and rapid heart rates. Basically, it's like out of the current, out of the set, out of their special ways. There is the secret regular electrical shocks that pass the heart and make a big problem eventually with age. Then we can have a tachycardia in the ventricles. Ventricle tachycardia, it's again rapid tachycardia signals from the ventricle that come from AV nodes, similar to the one in the atrial part. Then we have ventricle fibrillation. This is rapid and chaotic electrical impulse in the ventricles, similar as the one to the atricles. Long QT syndrome, this is a syndrome that have or expose you to a risk of a fast cardiac beat. So that's the most common tachycardias. Again, I repeat, they can happen in the atrial, the two left and right article, left and right ventricle, and then in the AV nodes or sinus nodes. When they don't work properly, they are not coordinated properly, they can all create tachycardia in a different areas of or different zones of the heart. And then let's talk a little bit about bradycardia, or the slow heartbeat. First of all, the slow heartbeat below 60, I will repeat, below 60 for adults. So first type is called sixth sinus syndrome, again coming from the sinus node that may be not sending enough impulse properly, that create the heart to beat too slow. And if it's bradycardial sixth sinus syndrome, this means it's too slow. If it's tachycardial syndrome, it means the heartbeat too fast, right? Number two, bradycardia, something else called conduction block. There is a block of the heart or the heart pathways near the AV node. Again, the AV node is between, I'm showing you my ridiculous thing. The AV node is between the atrium and the ventricle right here on the, I believe that's gonna be the left side of the, no, the right side of the heart. Forgive me, I correct myself. So the AV node is on the right side, and the conduction block is when there is a blockage near this node or their center, and that could be related to these ventricles that relate between the hearts and the veins that pass around the heart. So which can cause that part of this impulse or pumping of the upper or lower heart, a part of the heart could be slow or blocked, related to these blockages. And another thing is the last thing, that is called premature heartbeat. This is similar to a skipped heartbeat, but it's basically a heartbeat. It's kind of an extra heartbeat, but not completely. So it's a slightly weak heartbeat that create a longer problems. So that was everything for the heart rate and the blood pressure, guys. I hope you like these videos. Please press like, subscribe, comment, share this video with someone that can find it useful again. This is medical terminology. Make it simple and understandable for you. I hope you understand my explanations and my graphics. I hope you guys smile. You have a wonderful day. Stay positive. Stay tuned. Thank you for being here. That was everything from Denver, Colorado. Take care. Bye-bye.